Parathyroid disorders might sound complex, but they're actually quite simple once you understand the basics. In this video, we'll quickly break down hypoparathyroidism and hyperparathyroidism, what they are, how they affect the body, and the key differences you need to remember. Before understanding the disorders, let's quickly look at the parathyroid glands. These are 4 small glands located behind the thyroid, and they secrete parathyroid hormone, or PTH. PTH plays a key role in regulating calcium and phosphate levels in the blood. Any imbalance in this hormone, either too low or too high, leads to parathyroid disorders. Let's start with hypoparathyroidism. It's a condition where your body produces too little parathyroid hormone, also called PTH. This can happen for a few reasons. The most common is accidental removal or damage to the parathyroid glands during thyroid or neck surgery. Another cause is autoimmune disease. A specific example is autoimmune polyendocrine syndrome type 1, or APS1 for short. This inherited condition causes the body to attack multiple glands, including the parathyroids. There are also several genetic disorders linked to hypoparathyroidism. One is DiGeorge syndrome, where the parathyroid glands are missing or underdeveloped at birth. Others include HDR syndrome, also known as Barracat syndrome, and Sanjad-Sakati syndrome. Now, what happens when PTH is too low? 2 major effects. 1. Your calcium levels drop, that's hypercalcemia, and 2. Your phosphate levels rise. Both of these imbalances can affect your nerves, muscles, and bones. So what does hypoparathyroidism actually feel like? The symptoms mostly come from that low calcium we just talked about. It often starts subtly, tingling or numbness in the fingers, toes, or around the lips. Patients sometimes describe it as pins and needles. Then there's tetany, that's the medical term for painful muscle cramps and spasms, often in the hands, feet, or face. These can come and go or last for hours. People also report feeling unusually tired or fatigued, even after rest. On the outside, you might notice dry, rough skin and brittle nails that crack easily. And in severe untreated cases, low calcium can affect the brain, leading to seizures. If someone has these symptoms, especially tingling and cramps together, calcium and PTH levels need to be checked immediately. Now, how do we treat hypoparathyroidism? The goal is simple: fix the low calcium and control the high phosphate. First line, calcium supplements. These are taken daily to bring calcium levels back to normal. But calcium alone isn't enough. You need vitamin D as well. Why? Because vitamin D helps the gut absorb calcium. Without it, those supplements won't do much. Doctors usually prescribe active forms like calcitriol since the body can't convert vitamin D properly when PTH is low. In some cases, patients may need actual PTH replacement injections. This is a newer option and used when calcium and vitamin D aren't enough. Diet also plays a big role. The rule is simple: high calcium, low phosphorus. That means foods like dairy and leafy greens are great. But phosphorus-heavy foods like processed meats, sodas, and packaged snacks should be limited because high phosphate competes with calcium and makes symptoms worse. With the right combination of supplements, sometimes injections, and diet changes, most people manage well. What is hyperparathyroidism? It's a condition where your body produces too much PTH, that's parathyroid hormone. There are 2 main types. Primary, caused by a tumor or enlargement of the gland itself. Secondary, usually from chronic kidney disease or low vitamin D. So what happens to your body? You get high calcium and low phosphate levels. That's hyperparathyroidism in a nutshell. Now let's talk about what this actually feels like for a patient. When calcium gets too high in the blood, because of all that extra PTH, it starts affecting multiple organs. First, the kidneys. Too much calcium can form crystals, right pointing arrow, those become kidney stones. Extremely painful. Next, the bones. Your body steals calcium from your bones to keep blood levels high. That leads to bone pain, fractures, and over time, osteoporosis, which means weak, brittle bones. Then, the gut. High calcium slows down your digestive system, so patients often feel nauseous or get constipated. And finally, general symptoms. Fatigue, weakness, and frequent urination, because the kidneys are working overtime. So if you see a patient with kidney stones, bone pain, and fatigue together, always think, check the calcium and PTH levels. Now let's talk about treatment, and it depends entirely on which type you have. For primary hyperparathyroidism, where a tumor or enlarged gland is causing the problem, the standard treatment is surgical removal of the overactive parathyroid gland. It sounds scary, but it's a very common and highly effective surgery. Most patients feel dramatically better afterward. For secondary hyperparathyroidism, the cause is usually chronic kidney disease or low vitamin D, so treatment focuses on fixing the root cause, managing the kidney disease and correcting vitamin D levels. In many cases, that means vitamin D supplements and medications to control phosphate and calcium. If you found this helpful, give this video a thumbs up, and subscribe for more simple medical explanations. Thanks for watching. See you in the next one.